Hey, have you ever felt betrayed? Today in this video, I want to talk about something really special. Something we call betrayal trauma. It's when you've been betrayed by somebody and you start to feel traumatized, like in what we call post-traumatic stress. So if you've ever dealt with trauma, you got to check this out because betrayal trauma is super complicated. Check it out. Hi, I'm Brett, your favorite shrink, right? And welcome back. Welcome back to My 5 Minds. Today, like I said, I'm going to help you deal with betrayal trauma. This is a super important issue, but it's also an issue that's near and dear to my heart because it's a majority of what I help in terms of the recovery process in my clinic called ADDO. And in ADDO, we specialize in infidelity, compulsive sexual behaviors, sex addiction, betrayal trauma. Now, I want to talk about because it's not as straightforward and easy to deal with as you think. Because betrayal trauma mimics a lot of what we see with post-traumatic stress. And some people would even say it's the same. So it creates a new layer of complication. It's not just you're dealing with hurt. Gosh, you got betrayed, you got stabbed in the back, you had your spouse kind of basically turn against you. It's not just straightforward grieving that and then healing from that. There's some added complications that are brought on by what we see as these PTSD type symptoms. Now, as always, I want to talk about a case. Somebody I'm working with that will help you kind of give you context and understanding what's going on. So I'm going to talk to you about Kimberly. Kimberly came in and she was dealing with betrayal trauma. Her spouse, about a year ago, had an emotional affair that was moving quickly towards more of a physical and traditional affair. An emotional affair is when you develop a relationship with a person of the opposite sex that really mimics your marriage. It in fact replaces your marriage. The emotional needs for connection and love and intimacy, conversation, connection are all taking place with somebody else. And as you can see, as you can guess, that can quickly progress even into sexual realms where the sexual needs are happening. A lot of times affairs are one-night stands. They're betrayals, not necessarily with the relationship in the sense that the relationship's being replaced, but with emotional affairs, absolutely. It's a complete replacement where the emotions are being replaced. This other person is serving their spouse in terms of an intimacy emotionally, and then that can easily become, like I said a minute ago, become a physical affair as well. So it's a really much deeper, much more profound type of betrayal. And in this particular case with Kimberly, that's what was going on. Now, Kimberly was just really one of the walking wounded. It's like a feeling of being a zombie where you feel dead inside. And this betrayal that she was feeling was just going on and on and on and on for her for this past year. She'd gotten so tired of this betrayal. She finally went to Jim, her husband, and said, "Jim, I just can't do this anymore." And what she did was she set a boundary. She set a boundary for Jim and she said, by September 1st, this got to stop. I just can't keep getting hurt over and over and over again. So she said, you then need to stop hurting me and stop doing all these things that feel like betrayal, or I got to leave. I got to go. This relationship isn't going to make it. Now, on the surface, Kimberly's boundary sounds totally appropriate. But as we look into it, as we dive into it, what we see is that it's complicated. It's complicated by post-traumatic stress. Most of the time we think of post-traumatic stress as associated with the experiences that people in battle, people that have been in war, are experiencing. Where, say for example, you're a trooper and you're in this battle situation, and somebody that you care about, or even somebody that you have a friendship with, gets killed, and you're right there and you're watching this. You're watching them die. That's going to traumatize you. And as a traumatic event, what that's going to do, if it's true post-traumatic stress, is that you're going to find yourself having flashbacks. You're going to find yourself feeling hypervigilant. You're going to find that a door slam is going to set off your nervous system as if you're being shot at. You're going to find smells, sights, different events are going to bring back those feelings as if they're happening right now. That is our definition of post-traumatic stress. Now, our clinic, Addo, I'm so proud of, is because we are really leading the cutting edge in terms of research, looking at how betrayal trauma, how a spouse cheating on another spouse can create those same kind of symptoms that we're seeing in post-traumatic stress. Now, there's controversy around that. There's some people that really are offended by that idea, that somebody cheating on somebody, having an affair, is equivalent to being shot at, being in war, watching a friend, colleague die right in front of you. That kind of horrific event, or even a fatal car accident where your friend or spouse or somebody is with you and they're almost killed in a car accident. Some people are offended when you take a betrayal like emotional betrayal and compare it to those kind of really physical events, death, dying, near death. But I'm not really here to argue that. I'm not really here to say which is which, or if it's a fair comparison or not a fair comparison. I don't know. My personal belief is what's working, not what is true or not true. What works, what doesn't work. And for some people, this feeling of betrayal trauma really helps them understand their own emotional process. So in that sense, if it's helping you understand your emotional process, that you're feeling like you're having flashbacks, you're hypervigilant, you're feeling like it's happening over and over again, and you're cycling in the past again and again and again, and reliving traumatic events from your past. And if those traumatic events come from betrayal, then who am I to say that that is not your true experience? So I'm not here to talk about that. I'm not here to define if that is true PTSD or not true PTSD. But there are some complications that are happening that do make it a slippery kind of slope. For example, Kimberly and Jim. Now, in this situation with Kimberly, she has set a boundary with him. And she said, this marriage isn't going to work if you keep betraying me. And on the surface, that makes total sense. If Jim is still contacting this other woman, if Jim is still reaching out to other women and connecting with them, or having a sexual affair, or acting out in any way sexually outside of the marriage, yeah, Kimberly's going to continually feel betrayed. And for her to set boundaries around that and say, I'm done, and all that needs to stop now, totally appropriate. However, that is not the case. Jim, her husband, has been in recovery. He's been in recovery for about a year. He's going to men's groups. He's participating in 12-step groups. He has a sponsor. He's doing his steps to stay sexually sober, if we can use that definition. He's not acting out. He's not having an emotional affair. He's not looking at pornography. He's not doing anything. When she says you have to stop, what she means is he's doing things that are re-triggering her. For example, He calls her up on the way home from work and he says, "Hey, I'm coming home. I'll see you in a few minutes." And she says, "Great, that's awesome." And then he doesn't show up. He's like 20 minutes, 30 minutes late. And this whole time that he's late, she's thinking, who's he calling? Who's he talking to? Where is he? And she's feeling flooded. She's feeling flooded with all of these old betrayal feelings. And then finally, when he walks in the door, she's losing it. She's totally upset because, where have you been? She's having all these feelings of flashback. She's feeling flooded. And he's like, I just needed to stop and get some gas. And I went to the bank to deposit a check or whatever it was. Well, she's feeling betrayed. One, because she doesn't know where he is. And he said he was here. He was on his way home. And he wasn't. He went to the bank. He went to the gas station. And all of those things are innocent in the sense he wasn't having an affair. But for her, they bring back all of her hurt feelings. And those kind of things happen frequently for couples. And so when she's setting boundaries, what she's saying is all of those things have to stop. He has to be 129% clear, honest, and communicating everything. Otherwise, she's feeling traumatized again and again. Now, as a woman experiencing betrayal trauma, on some point that feels true and that feels appropriate. But here's where it gets complicated. If this is true, PTSD, post-traumatic stress disorder, the complication is, PTSD is when you are reliving past events as if they're happening now. They're not. Nobody's shooting at you right now. Your car's not rolling over right now. You're not in any kind of danger right now. But your nervous system is flooding with all of those same feelings. And what she's saying to him, to Jim, is, you can't do anything that's going to cause me to have PTSD symptoms. How's that going to happen? That's never going to happen. Because the whole definition of PTSD is that you're going to have these flashbacks brought on by situations that are not equivalent. You're going to hear a car backfire and you're going to feel like it's gunshots. That's what's going to happen. That is the definition of PTSD, is that you're reliving the past when it's not happening. And what she's asking is for him to stop all activities that could, in the slightest way, set off her PTSD. That can't happen. One of the reasons why I love looking at post-traumatic stress as a part of betrayal trauma is that it helps validate women, particularly, to feel like they're not crazy. Oftentimes when men are caught in affairs, they're in denial. They're denying it. "Oh, no, that's never happened. I don't know what you're talking about. You're crazy." As we talk about betrayal trauma, it helps the woman feel like, "Oh, I'm not crazy. I'm having all these flooded feelings. I'm having all this anxiety. I'm having all these flashbacks for a reason. I'm not crazy." And so it's really super validating to say, no, you're experiencing the same symptoms of post-traumatic stress. These are normal feelings. Now, here's again where it gets complicated. The definition of post-traumatic stress is you're having false feelings. So on one hand, I'm validating and saying, oh yeah, your feelings are totally appropriate. This is what you're experiencing. This is what you're going through. Oh, how validating that is. But then on the other hand, I have to also say to that person, but all your feelings are false. That's the definition of post-traumatic stress, is that you're having flashbacks in circumstances that are not true. And so what Kimberly has to do is she has to realize that her feelings are her feelings and they're part of her trauma, totally legitimate, but they're her feelings and they're false. Jim can't do anything. Jim has to work his recovery. Jim has to work his program. Jim has to make sure he's doing what he's doing. But he can't stop her from having flashbacks. That's her treatment. That's her recovery. She as part of her recovery, has to define for herself when really she is in betrayal and he is cheating, looking at pornography, dating somebody else, all of that stuff, and when he's not. And when he's not doing those things, but yet she's being triggered, she has to come and get in control of her own emotions. She has to say to herself, she has to look at these feelings and say, these are not real. These are not true. If he says they're not real or true, she's going to, again, have flashbacks. Wait, you said they're not real and true before. She has to grab a hold of her own feelings and look at her own feelings as not being real and not being true, which is kind of a paradox, right? Because he was smoke screening her. He was gaslighting her, is a new term we use. He was gaslighting her forever, telling her feelings were a lie. And now she has to look at herself and look at the fact her feelings are a lie. And she has to get in touch with that for herself. And that is the difficult complication. If you are dealing with betrayal trauma, you can't do it with a video. You can't do it with me talking to you. Hopefully, I'm going to help explain what's going on, but you need treatment. You need help. Both of you guys need help, both individually and in your relationship, to be in your relationship. So with Kimberly, what we had to do is we had to start bringing Kimberly and Jim in together and talk about PTSD, post-traumatic stress, and how she's having flashbacks and how she needs to manage those flashbacks and communicate with Jim about her flashbacks and her feelings, and really even use those feelings to create intimacy, to build a relationship of trust. She needs to use him as her confidant, which is super hard and scary. But that's the only way they're going to get in recovery. And if you're dealing with similar feelings, you have to do the same as what Kimberly's doing. So I hope this is an encouragement to you and a challenge to you to help you see that this is a bigger picture than what you can probably deal with on your own. Just like any PTSD situation is. And my encouragement for you is to get the help you need. Again, I hope this was helpful. If you liked it, like it. And make your comments. Give your feedback. I want to hear where you are and what you're feeling. And if you're in recovery, I want to hear about that. If you're not, I want to hear about that. Again, I'm Brett, your favorite shrink. And you are watching My 5 Minds. I'll talk to you soon.